Do you know your tendinitis from your spondylitis? Below par with PMR? No doubt about gout? The Rheumatology Physio website is teeming with content to engage with. Downloads, books, courses and more to address any gaps in your knowledge. Head to rheumatology.physio, your one-stop shop for rheumatology information.
Hello, Claire Callaghan. Welcome to Chewing It Over. Let's launch straight in and talk about what MSK clinicians should know about perimenopause.
Oh, well, thank you for having me. I think fundamentally the first thing that we all need to know is the basic physiology of what's going on with women. So, of course, perimenopause, is that term which refers to women sort of in those years leading up to menopause. And then the menopause itself is that one day when women's periods are stopped for a year, and the average of that is 51 in this country. So really it's knowing that basic physiology and the fact that the estrogen hormone in particular will drop off quite sharply during those years, but it will also, women will go through periods where that level is fluctuating. So they need to think about the fact that women are going through significant change, and of course progesterone and testosterone also have influences on the musculoskeletal system, and testosterone particularly with regards to muscle, and that is also changing during this time. So I think it's knowing the physiology, and then knowing that women have a lot going on at that time, might be symptomatic more broadly with a whole bunch of other symptoms that we can delve into as well, and that some of their aches and pains and musculoskeletal issues may well be related to these hormonal changes. And of course, they may be related to other factors such as their biomechanics, their training and so on. So it's really knowing that physiology and understanding where women are in that path. Yeah.
As that's an additional factor.
That
type.
Sure.
When would you start as a clinician to be suspicious that maybe this could be perimenopausal, that could play a factor in this injury or rehab?
I think we're lucky most of the time with having the one-to-one time to get to know our patients, that usually through the conversations people will sometimes reveal that they've been feeling really tired, they've got a bit of brain fog, they sometimes even volunteer that they're perimenopausal. Certainly in our medical questioning, we are, might have a question there about periods, frequency of periods, and so on. So some of those things might flag you up to the fact that women are going through this stage. And then it's like it's really looking at particular issues that are more problematic, more common with women going through menopause, particularly the tendinopathies. So your gluteal tendinopathy, your Achilles tendinopathies, your plantar fascia issues are very common in perimenopause. How much that relates directly to the menopause, we don't know for sure, but there certainly seems to be a correlation between tendon health and your estrogen levels, as best we know. So it's worth exploring that. And then bony issues as well. So again, I treat lots of women who do weight-bearing exercise, and you've got your runners who might be experiencing more anterior shin pain, more anterior pubic pain, for example, and you've got to be thinking, well, the bone health, obviously estrogen is really important in maintaining that. Perhaps as this is dropping off, is that an element within this woman's musculoskeletal problem? So they're the flags that I look for. Yeah.
Got you. And roughly what kind of age range would that tend to impact?
Well, I would say, you're probably looking at 40s to mid to late 50s really would be the broad age bracket. That said, there are going to be a number of women who will go through a surgical menopause. So they might, for example, have had cancer or be on cancer therapies or other drugs, which mean that they go into early menopause. Again, you're probably flagging this up with your medical questionnaires at the start of your assessments. If you come across patients like that, and there seem to be an increasing number of them with breast cancer survival, particularly on the increase, which is fab. With those women, you're going to be thinking about there. And there's also a category of women, of course, who go through an early menopause just because that's what happens to them. So they go through that premature menopause, and that can happen at any age, but, might be in their 20s or 30s, go into an early menopause for just because that's the way their body is. So there's those women as well that we need to be mindful of as well. Yeah.
Yeah. So it's not necessarily just that typical kind of, someone in their 40s kind of category.
Yeah, that's right.
You talked in your therapy live session about the impact on tendons and bone health, which I think is hopefully increasingly kind of on people's minds as a clinician, like monitoring tendon health and bone health. You also talked about the difficulty in building muscle in hypertrophy, which I thought was perimenopause. Would you mind talking a little bit about that as well?
Of course, yeah. So obviously, our muscle health is helped maintained by our hormonal health as well, hormones as well. So for all adults, we can lose between 3 and 8% of muscle mass per decade from the age of 30. And those figures, the Chartered Society of Physio has got that on their website. That's a well-known fact. But that said, of course, we can influence what that rate is by what we do. So that's not a hard and fast. But then when you look at women as they move through the perimenopausal years, they can lose as much as 10% of their muscle mass at that time through the perimenopause, from their 40s into their sort of early to mid 50s. So clearly an opportunity for us to think about that. Now, it seems that it's not just the muscle mass that's affected, but there are also studies now which show that that potentially the quality of the muscle is affected as well. So there's some recent Finnish studies that have shown that. And moving on from that, then you'd be thinking, well, what's going on with the quality? It also seems that the neural signal to those, the neural firing might be affected as well as we get older, because it seems that the reduction in muscle strength isn't just to do with age. There's a large study done by Bondarev et al., and it's referenced both in 2018 studies and by that author, and also 2021 studies. And they looked at nearly 900 women who were, pre, peri, post-menopausal. And what they found, that there was a drop-off in knee extension torque and vertical jump height, and muscle strength in their hands as well. They looked at grip strength as well. And basically that change wasn't just to do with age, it was correlated with their menopausal status. There's muscle strength changes that are happening in correlation with menopause as opposed to just age, because of course there's going to be some with age, isn't there? And then the other thing that is interesting about that study, though, is that it showed that the women who were fitter and stronger at the start, when they were going into the menopause, actually still ended up doing better than if they hadn't done that. So I think that's really reassuring for all of us, that if, there's a light there, that if we work hard at it, then obviously that's going to help us going forward. Yeah. So they're the key things really that to be thinking about with regards to muscle. And there is some good research starting to come through on that. And that's it's not just the mass, it's also the quality and perhaps the firing of the nervous the signals from the nervous system going to the muscles.
It does feel like when it comes to women's health, bone density included, the sooner you start, the better. The sooner you start to build up some fitness, some tissue tolerance, the better. And what implication does all of that have on the clinician planning a rehab program? Maybe for somebody with, let's take a runner with an Achilles tendinopathy or a patellar tendinopathy. We're wanting to load that muscle. Are there any specific things we need to think about if that person is perimenopausal?
Sure, yeah. So first of all, I think, there's different things at different stages in life, aren't there, of what our tolerances are. And I think with these women, again, there's been some quite good studies to show that they've got a lot going on in the background a lot of the time. They're, stuck between, various caring responsibilities, jobs, stresses. And then if you're thinking about the symptoms of menopause, I mean, some women sail through it and it's great and, brilliant. But some women, and it's worth exploring a little bit in a very gentle and sensitive way, finding out, and usually women will tell you if they're struggling, a bit of brain fog, really fatigued, energy levels dipping up and down. So I think when we think about exercise prescription, we've got to sort of meet our patients where they are, as we would always. So if you've got a high, a woman who's, a high achieving athlete, doing really well, not suffering any symptoms, perhaps in their late 40s, who's got an Achilles tendinopathy, you would just load it as you normally would with, you would gently, step up the rehab incrementally as you normally would. But if you've got someone who's struggling with a lot of these other issues, then you might do it in a more gentle way. Your progressions might be a little bit slower. So that's number one consideration. And then the other thing is, we know that women at this stage of life potentially will have a reduction in their balance. As I mentioned earlier, things like vertical jump height can reduce. So we need to make sure that we're maintaining the spring and that quick high tempo response in the muscle. So we need to think about that, you might, of course, do some eccentric work or isometric work, but then you want to be, using your example of Achilles tendinopathy, you want to incorporate, some jumping, some hopping, some bouncing here, because we're thinking, we want to stimulate that muscle. It needs, that quick fire, and we need to support the bones and the balance in these women. So they're two of the key considerations. And also it might just take a bit longer as well. Patience is definitely required. A bit of empathy from us as well doesn't go astray, I don't think.
Manage that expectation. Yeah.
Absolutely, and for us as clinicians, I know in MSK, like, you kind of want to crack on, don't you? But actually,
No, makes sense. And in terms of I remember a part of the webinar that you did for Therapy Live. You talked about how a lot of women reaching perimenopause they're concerned about their weight. They're perhaps gaining weight. They're using exercise as a way of managing that. So there is this possible recurrence of, you think Red S, the energy deficiency in sport. You think in your teenage kind of category, in your 20s, but actually this is something we should be aware of in this category of women too. Would that be fair to say?
Absolutely, yeah. I mean, I'm lucky enough to work closely with some dietitians and nutritionists who definitely flag this, who are working in the sort of perimenopausal space, and they flag this up to me. They bring it to my attention because they're talking, we might gently, discuss energy levels and nutrition, but obviously they're going in a much deeper dive. And it does seem that, obviously we all know that, if you're not getting enough energy in, you won't be, supporting that bone health. You won't be supporting your hormonal health in the way that we really should. So it does seem that, women are potentially prone to, not having the right nutritional intake, and therefore that's going to impact their injury profile, their healing, and so on. So, yeah, and again, that's supported in the literature as well, that women of that age. There's a recent paper by Rothschild et al. That came out in 2023, and it references that particular thing. But yeah, anecdotally from speaking to dietitians and nutritionists, they see it as well. So.
You can see that becoming a perfect storm, can't you, where somebody takes up something like running as an activity, cuts down their diet as well, and at the same time is going through these perimenopausal changes. So you can imagine, no wonder there is some sort of deficit there.
Yeah, I think most of us who've worked, with postnatal women, with perimenopausal women, we've seen patients like that, haven't we? They sort of, want to lose the weight, but actually, one, is that really healthy for them, and to do it as quickly and rapidly? And we need definitely the support, and education's huge in that, isn't it? I mean, that's part of what we do.
Yeah, absolutely.
Yeah.
Can we talk a little bit about what people may take in addition? I appreciate it's outside a bit, like outside of the physio realm, but things like either hormone supplements that a GP might prescribe to that person, or things like additional collagen. There's a lot of this kind of stuff around these additional that protein. What's the evidence for that? What's your experience of these things?
Okay, so I'll speak about the medical side first, the hormonal therapy, and then I'll speak about the collagen and so on. So hormone replacement therapy, two key indications for that, according to the NHS and the National Formulary, are management of symptoms of perimenopause and menopause, and to support bone health. So, some of us will have patients on this for sure. In terms of what does it actually do for our musculoskeletal system and what's our place in it? I think if we are seeing women who are clearly struggling with, some classic symptoms of perimenopause, really heavy bleeding, really struggling day to day, migraine headaches, brain fog, the works, then I think it's our role as healthcare professionals to gently signpost them to the GP to discuss that. Not our role to sort of, have an opinion on whether or not HRT will help, but certainly our role to signpost them. Because HRT has been shown to have those benefits, and the women's health study in the early 2000s that did cause a lot of concern. Some of those concerns have been allayed, and I think people are regularly monitored on on hormone replacement now. The other thing to know is that there are very, very limited studies into how hormone therapy really affects musculoskeletal health beyond the bone health issues. Well established to support bone health and women who are at risk of osteopenia and osteoporosis. There's a study by Callaghan et al. That came out in 2022 looking at this. And the results, they were okay, but they were certainly, this was not a big scale study. They were not, it was a small scale study, not that many subjects. And it did show that for gluteal tendinopathy in perimenopausal women, that there was a benefit of education plus exercises, plus the use of hormone replacement therapy. And that benefit seemed to be greater, or was greater, in women who had a BMI of under 25. So there was a benefit, but, I think, that's one study, and it wasn't, you can't, hang everything on that for sure. I mean, we think that there's an element, the studies have shown that it seems that there's an element of relationship between estrogen and tendon health, but we can't say it's definitely going to change taking hormone replacement therapy is going to fix your tendon problem. We all know it's more complicated than that. And also, the evidence just isn't there. But studies are ongoing, and it's a bit of a watch this space. And it's exciting to think that there could be something else that, could potentially help. But we don't know. And I think it's important for us to send that message out there, because even amongst the medics that, I don't know if people, follow various people on Instagram or listen to podcasts and stuff, but, even with different medics, you'll hear different messages. And I just think we have to stick to what the NHS line is for the moment and where the evidence is at. And collagen, you're asking about that. A lot of people, will be familiar with having patients in clinic and then being asked, I take this, I take that. Does it help? Glycosamine, collagen. So what is going on? So with estrogen supports the collagen in our body. So that will not only be the lovely collagen that's in our skin, but it will also be the collagen that supports is within our articular cartilage, our ligaments, our tendons, and so on. And then there's different types of collagen. So some tissues will have type 1 collagen, some tissues will have type 2 collagen, and so on. So first of all, if people are taking collagen, then is it even the right collagen to support the kind of problem that they've got? That would be a reasonable question. And most people will not, I can guarantee, will not have thought, is my ligament type 1 or type 2 collagen? It's just not the level that people are at. Generally speaking, unless they're like a musculoskeletal biomechanics scientist. so there's that. And just, again, chatting to different nutritionists and dietitians, there's variations in their thought about the evidence base for this, about what supplements affect collagen. And again, it's beyond my remit. But if anyone wants to look into this further, I'd really recommend going and having a look at Stacey Sims's work. So she's actually got a really good blog, actually, that explains in very high-level science the different types of collagen and what women need to look for in a collagen supplement if indeed they are going to use one. And so Stacey Sims is a doctor from the States who's a nutrition scientist, but also, very knowledgeable about biomechanics. And then she even does an e-learning module, which I have to say I haven't done, but would be interested, curious to do on collagen and musculoskeletal health in perimenopause. So, but the evidence just doesn't, I think there's a lot of other things that people could do, and probably a lot of other things they could be spending the time and money on that we know work as well. I think that's kind of where it sits, really. But that's just my take. Yeah.
No, it's interesting because I follow some running accounts on Instagram, and as I enter deeper into my 30s, it is constant adverts for various collagen supplements. You start to think, oh my God, should I be taking this? As you say, we don't know yet. We don't know. But various companies will sell you it.
And if you're getting asked, your patients are as well.
Absolutely. Yes, exactly. They're encountering this as well. Yeah, for sure. Let's end on a positive as well, because I can appreciate if you're deep in the perimenopause and you're facing pains that that just seem never ending and tendinopathies, and you just want to do your sport. You're probably thinking, is it worth it? Shall I keep going with this? Would it just be easier if I stopped? What would be your answer to that scenario?
It's definitely worth ploughing on. We all know that physical activity is good for us. It's hard to see that light sometimes when you're, as you say, deep in pain and the midst of injuries. It's about, I hate to say managing expectations, because that's really hard for most of us. But I guess it's us helping meet patients where they're at, looking at what they can do, looking for the positives of what they can do. And, things like weight-bearing exercise, resisted exercise, high-impact exercise, if people can do those things. We might be modifying the level of intensity, but those three things are really fundamental to maintaining musculoskeletal health. We might need to modify the intensity. You might need to pick which day you're doing it. You might even need to pick which time of day you're doing it, or do little bits often rather than big stints. And I think, again, there's some research to show that meditative exercise is also very nice for women at this time of life. So it might be that people, I've had women like this come and see me who are used to, they're hooked on the endorphin kick that they get from their high impact exercise and running marathons or whatever. But actually, it's a change in perspective, and it's not, you're not getting out of it just because you're not doing all of that. There are other valid forms of exercise like yoga and Pilates, which, you're still being active, you're still supporting your health. And it's actually been shown to be really good for our mental well-being during perimenopause. So, there are always options, and it's good for you. Keep persisting, but just maybe be creative, I think. Yeah.
Excellent. As you kind of move through menopause, I remember, I forget the person who did it, so apologies to them, but there was a CPD that the physio might have done about the menopause before, and the person who talked about how systems adapt. So you have that deterioration, that decrease in hormones, and then your systems tend to adapt. Like you get used, your brain fog eases because your brain kind of adapts to that different level of hormone. There were some places that never did really adapt, I think locally, so where your hormones are rich locally, like the reproductive system, which didn't adapt as well. But does the same thing happen with if you stay active beyond your 50s, your 60s? Can you adapt, or are you always at more risk of things like bone density issues, tendinopathy, even when that hormones have plateaued out because they're at a much lower level than they were earlier on in life?
Yeah, that's such a good question. So with regard to bone health, my understanding is that your risk of osteopenia or osteoporosis is only on the increase as you get older because of the thinning of the bones. So, you're still, so for example, with bone health, your bone density and bone mass, you're reliant on that constant turnover, the breakdown and the buildup of bone. And because estrogen is such a key driver of that, that change in hormone, plus the fact that, your bone density sort of peaks when you're sort of in your late 20s and then is on and down. So that happens. And it happens to men too, but just not at that acute deterioration and then slide up. It's more of a gradual. So bone health, no. Muscle health, as I said earlier, it's that cumulative potential loss. So it's really vital, if you keep up that weight-bearing exercise that will support your bone health, you keep up that resisted exercise, which will support your muscle and bone health, then, you can mitigate some of this. You can maintain, that muscle strength, muscle mass, muscle quality by the use of it as well. But with the tendinopathies, my understanding is that, and there'll be people who are far more expert on tendinopathy than me, but looking at the work of people like Alison Grimaldi and Pete Miliaris, with regard, and Jill Cook's team, and you can tell I'm referencing Australians, sorry. I'm playing Australian background, I'm more familiar with some.
I'm good at it.
But a lot of their papers look at the younger population. So, Alison Grimaldi's work really does say, the peak time for gluteal tendinopathy is that 40 to 60 age group. That said, I've had plenty of patients who are in their 70s who have it, but perhaps it's more associated with the fact that they've now got more risk of osteoarthritis. So they've got an osteoarthritic hip or lower back, and then they're getting the tendinopathy. So, and similarly with the Achilles, I'm just not sure, but I think a lot of the study, we all know there's a lot of studies done on young recruits, and it's an area we need to, rather than having big studies on, army recruits, we probably need more studies on older women to find out the answer to your question, I think.
Yeah. No, interesting. Thank you very much. Yeah. Brilliant. Well, that's brilliant. Thanks again for joining me this afternoon, Claire.
No, thanks for having me.
Do you want to direct people to where, and I'll tell people about your Therapy Live session at the end, but if you want to tell people, if people need to know more from you, where can they find you?
Sure, thanks. So my website is just my name, clairecallaghan.com, and I'm on social media at Physio Claire Cal, be that Instagram or Facebook generally. So and there's, for example, the collagen stuff, I've got a little thing on my Instagram where I break that down and did a whole series of tiles on that, and I'm always there talking about it. So and you can subscribe to my newsletter on my website as well. So thank you so much for having me. It's it's great that this stuff is getting profile now, I think.
Yeah, absolutely agree. That's brilliant. And yes, if you are watching and you want more of this kind of topic, you can watch Claire's session, Perimenopause and Running, which featured on our June 2024 Therapy Live. You can watch that if you're a premium member on our site. But otherwise, thank you very much, Claire, for this afternoon.
Oh, pleasure. Thank you so much for having me.
No problem.
Here at Physio Matters, we think physio matters. Become a member today and access over 500 webinars, get free tickets to shows and access new content instantly. Access at home, work or on a ferry to ensure your CPD is all smooth sailing. Physio-matters.com, more content than you can take through customs.